Hello, this is Siddharth Damber from Chicago Arthritis and Regenerative Medicine. In this video, I would like to give you a big picture sense of how we utilize the regenerative medicine treatments that we offer in the office. There are a number of different treatments that we offer. The two main ones that really make up the bulk of what we're doing involve utilizing either your own platelets or your own stem cells. So first and foremost, we're really primarily utilizing only your own cells. That's important because as opposed to other treatments that are utilizing other people's products, utilizing your own cells is number one, safer because there's no significant risk of rejection. Number two, we know exactly what we're utilizing, live cells that are coming from you. In addition, there's lower risk of infection and reactions. And then lastly, the data out there shows that regardless of your degree of pathology or age or other medical issues, utilizing your own cells can still give a very good result, and it's always what I'll recommend first line. So of the two treatment options that we're typically utilizing, there's platelet-based treatments from your own blood, and there's also stem cell treatments that typically we're getting from your own bone marrow. So the reason why we use these two different types of cell types is as follows. Number one, your own stem cells or mesenchymal stem cells are the chief cell that coordinates a reparative process when you've had an injury. So if you've had an acute injury, in general, those mesenchymal stem cells are what helps to direct and control that reparative process. If you have a chronic injury, we utilize stem cells to help reinitiate that healing process and to direct it back into a healing mode. We get stem cells from your own bone marrow, mainly because that's where the data for orthopedics is most dominant, and we have excellent data that shows that utilizing your own bone marrow-derived stem cells gives a good result even if you have a significant degree of arthritis or a significant injury. The other cell type that we predominantly use are platelets from your own blood. We utilize platelets and the growth factors from the platelets. The way that these cells work is that they help to stimulate your own mesenchymal stem cells. So they're a good add-on treatment to a stem cell procedure. So how do you use one versus the other? So if you have a mild to moderate injury, we're generally utilizing platelets as a first-line treatment. If you have a moderate or more advanced injury, we're generally utilizing your own bone marrow-derived stem cells. The way platelet treatment protocols work is that you come in first thing in the morning, you get a blood draw. It takes us a couple hours to prepare that in our own lab in the office. We then re-inject your own platelets and the growth factors on the platelets later on in the afternoon. The way that we utilize stem cells, it's a three-step protocol. This is a protocol that's been originally devised by the Regenix Clinic in Colorado in 2005 and has been progressively revised and improved upon since that time. It's a three-step process. The first treatment is basically a pre-injection where we're utilizing a concentration of sugar water and inject that into the area that's been injured, whether that's the joint, the ligaments, the tendons, the soft tissue structures. It creates a mild inflammatory reaction. That inflammatory reaction helps to stimulate your own mesenchymal stem cells that are already on site. It also helps to prepare the joint and the area that needs to be treated for your eventual stem cell treatment. So that's treatment one, that pre-injection. You come in a few days later, at which time in the morning, we first do a bone marrow stem cell extraction. We then prepare that into what's called bone marrow aspirate concentrate that has a number of cells that are helpful for a healing environment when we re-inject it. Most importantly, your own mesenchymal stem cells. We then re-inject that as part of your stem cell treatment later on in that afternoon, targeting the area that needs to be treated. You then come back in a few days later for one last treatment, for one last platelet treatment called platelet-rich plasma, where again you come in for a blood draw first thing in the morning, prepare over a few hours, and then re-inject that one last time into the joint that needs to be treated. Purpose of that last injection, again, platelets and the growth factors from the platelets stimulate and aid the function of your mesenchymal stem cells. And so we are trying to stimulate that initial stem cell treatment with your own platelets and growth factors during that last procedure. That's big picture in terms of what we're doing. We obviously personalize and focus your treatment based on exactly what your condition is, and that can tweak your protocol a little bit. But those are the really big steps when it comes to either platelet treatments or stem cell treatments that we utilize in the office. I hope that gives you a better sense of what we're trying to do and can help explain why we utilize the protocols that we do. Thank you. Have a good day and live well. Bye-bye.